And welcome back. The International Extremity Project, or IEP, provides support for humanitarian projects and supplies medical assistance to the people of Vietnam. The medical mission corrects physical lower extremity deformities to give a new chance at life to many needy Vietnamese. As part of their mission, 12 health practitioners from the United States are in Namibia to provide free health care to needy patients with orthopedic conditions. In light of that, we're now joined by Dr. Bruce Lehnert, who's the co-founder and medical director of the mission. In studio, good morning to you and welcome.
Good morning. Thank you for having me.
It's a pleasure. You're saying it's your third time here?
Yes.
And you've been operating from Windhoek, basically?
Yes. In 2012 and 2016, we were based out of Katatura Hospital, and this year at Windhoek Central.
Okay. Talk to us. Perhaps you can give us a bit more background and expand on the Extremity Project. What are its primary objectives, and why have you decided to, create this platform, this project?
Sure. So our mission is to combine international medicine, charity, and education into a bundle that provides correction of lower extremity deformities in disadvantaged children and young adults.
And why did you see a need to have this project?
Honestly, I was invited on a trip to Vietnam in 1998, and it caught me. Made me interested in what was going on, and I thought I could do this in a way that was a little more effective than what was being completed at that time.
Okay, and since you've been doing this work for quite some time, many years, what are some of the highlights that you could perhaps share with us, and types of cases and medical corrections that you've done where, it put a smile on somebody's face, perhaps?
Well, it puts a smile on the face of our patients and tears on our eyes when we have people come back that we've operated on a year ago, 2 years ago, 10 years ago, and they tell us their stories. Wow. So we have people who are housebound, not going to school because of the social implications of having a deformity. They come back, they go to school, and we see them years later blossoming, owning businesses, advanced degrees. It's really wonderful.
Let's talk about the conditions that you do tackle. Perhaps you can give us more insight into podiatric medicine or treatment and how it works and the types of extremities?
Sure. Well, podiatric medicine is a focus of correcting foot and ankle conditions. Yeah. Right? So we specialize in below-the-knee disorders. And for the most part, when I go to Vietnam and Namibia, we see the effects of infection, such as polio, such as diseases with high fevers that cause brain injury, that causes imbalance of muscles and hence deformity over time. Wow. We also see a lot of post-traumatic conditions. So someone's had some type of fracture or trauma many years ago or many months ago, and they haven't recovered. Yeah. So we work on fixing that for them.
So you make them a bit more mobile.
Absolutely.
That's fantastic. You've got 12 volunteers who are in Namibia now to provide this type of free health care to patients who need this type of treatment. How can the patients perhaps use this opportunity? Where do they come to perhaps also get a checkup to see if there's anything that can be done?
Sure. Well, staying in contact with their doctor and letting them know the problems that they're having is the most important way for us to have them fed into our system. But they can also pay attention to our website, extremityproject.com, because we always detail our schedule of medical missions.
Okay. Your medical mission, speaking of, is correcting the physical lower extremity deformities, as you've said. But have you considered perhaps setting up something in Africa?
Well, this is something set up in Africa. We'll be back again to Namibia for sure.
Is it an annual project?
Yeah, we think of this as like a biannual trip.
Biannual trip. Yeah. Okay, and you are primarily in Windhoek. Are there any other African countries that you go visit?
I was supposed to be in Angola last week, and some of my team members went, but I did fall ill, so I could not make the Angola trip.
All right.
But on this trip, we did have Angolan doctors come down from Luanda to spend time with us.
All right, that's great. Doctor, perhaps you can talk to us about this project has changed your life.
Sure. I've grown in so many ways to see the other side of other people's lives in a way that you're just not taught in an advantaged world. When you really see somebody who's struggling with need and you affect their life and see the way it changes, it's really life-changing.
And how do you get to provide this health care for free? I mean, it is costly to perform surgeries and so forth. Do you have sponsorships? Do you have companies that are you know, sort of sharing some funds with you?
Sure. Well, we contact different organizations in the United States. Project Cure is one of our primary sponsors, and they provide instrumentation. And then I rely on donations from my patients, honestly, and friends to make this happen. Yeah.
Okay, okay. As we wrap up, you've equally published many scientific articles. Perhaps you can tell us about one of them that is possibly interesting.
Sure. Well, there's a couple of articles that we've developed techniques in our medical missions that we bring back to our own practice. So there's a couple of them regarding tendon transfers that have been very helpful in our own, you know, practices on a day-in, day-out basis.
All right. Thank you so much for coming in, and all the best.
Thank you.
All right, there you have it. That's Dr. Bruce Lehnert. He's the co-founder and medical director of the International Extremity Project Mission. And they're here in Namibia, and it's free health care for those who do need it. And they're obviously working with the doctors here at home to make that possible. Do stay tuned. We'll be back.